Mental health increasingly is a topic for many players in society, which is really good news because mental health is just too big a topic for mental health providers alone. For leadership, that means that you have to become a network player. And IIMHL, for me, is really a great platform to meet all different sectors.
It was good to hear how other people and other countries trying to solve their problems because they have the same issues as we have in Greenland.
The common language we came up with after the 2 days, it was an intensive 2 days, but the common language then brought us to a cohesive collective voice, which was the person-centric model is the way we need to go. All of us could agree at the end of the day it's the culture that will help us succeed in this way.
What is Australia doing? What is New Zealand doing? What is Scotland doing? What is England doing that may be a best practice? So I like to think about it as stealing best ideas, bringing them to the United States, and improving the care in the United States with those ideas.
It's benefited my country by understanding what other countries are doing in a whole range of areas, from leadership, employment, self-directed decision making, and also that because we are rolling out a new way of providing disability services in our country, and so there's always lots to learn and share.
Now, if you talk about the Netherlands, well, we're the new kid on the block. We only became a member this year, and but it already benefited us because in IIMHL we learned about Thrive. That's an intersectoral initiative to improve urban mental health. And we saw examples in New Zealand, in the UK, in USA, in Canada, and we thought we want to do that too. So now we have Thrive Amsterdam, and that we really owe to IIMHL.
Well, it's very easy to be isolated as a mental health leader, and one of the things I love about IIMHL is that the exchange links you up with mental health leaders from all over the world. Even your peers in your own country are sometimes thinking in the same way. But when you get linked to people from all across the world, you start thinking differently. You can see people who have actually accomplished what you're trying to do, and you can make partnerships with people who are trying to do the same thing.
The initiative has really benefited my work because this is the second time I've done it. I first did it 10 years ago, and some of the connections I made 10 years ago are still people that I have regular communication with. So it's been good sharing of ideas, ideas from other countries that I can then take back and implement in my work.
The exchange opportunity here at IIMHL has brought my team inspiration and innovative ideas, and we're really excited to go back and start using the ideas that we have. The exchange has also allowed us to develop relationships with youth advocates in other countries that we could never have imagined. I think specifically it has felt really inspiring to know that there are other dedicated youth advocates that are in this work, and it feels like we're better connected and therefore stronger as young people.
The whole initiative here is inspirational and very powerful, and the message of recovery and the importance of service user as part of that development of mental health services globally is so important, that we sort of remove ourselves from the traditionally focused model to real recovery, and that means service user engagement and involvement.
And the benefit to Indian country in the United States, tremendous. Our Indigenous batch that we had, Indigenous Mental Health Leadership Match, commonality of Native people, Native way of thinking, and they all exchanged tremendous expertise, and a lot of good information will come forward from that.
For my country, I think it's also been, New Zealand's at a point of change. We're doing a lot of really innovative work around primary mental health and changing our system. And certainly I was at the last meeting in Stockholm where I participated in the primary mental health match. And definitely I got lots of ideas, and I'm pretty sure that a number of us New Zealanders who were in that match took many of those ideas back, and we've been using them in our primary mental health rollout. So it's been great.
This is my 6th IIDL conference that I come to. I've been to Manchester, Stockholm, etc. And each conference is getting really better and better. It's amazing. The exchange took place at the American Psychology Association, so me being a psychologist was like going to the Olympus. One of the things that I'm taking away from it is the importance of collecting long-term data, because if we want to be able to go and tell the story of why leadership matters, we need hardcore data.
Today we had a really interesting discussion about what are some of the disruptive innovations, and the work, for example, that IIMHL is doing through the I-Circle, the mental health of cities, the notion that mental health is about all of us, whether it's in the workplace, whether it's about system improvement, whether it's improving housing infrastructure, whether it's mental health literacy, whether it's community engagement. Those initiatives can be applied anywhere in the world, and for example, Cities Rise is doing it in places like Chennai and Nairobi. So I think that shows the reach of IIMHL and the great work that leaders from across countries can do when we have an opportunity to share views and learn from each other.